Today I'm going to take you through our first response kit. So I'm going to start with our top front pocket, which is our vitals management pocket. So we should have our blood glucose level kit. We should also have our thermometer with extra covers, a stethoscope, shears, pupil torch, and an adult's and child's BP cup. And the next pocket, this is where our paramedics are going to keep their drug kits, but only if we're working with paramedics. So we're also going to have our protective gear such as our glasses and our gowns and our face covers if we need them. This is our hemorrhage management pocket, so also known as our bleeding pocket. So we've got tourniquets, bandages, saline, and also medical tape. On this side, this is our blood glucose level management side. So we're going to have glucagon, glucose, and some hypogel at the bottom here if we need it. This side is going to be our just kind of extras. So we've got our vomit bags, ethyl chloride, and spinal lanyards. So now we move into our main pocket. So this is the one we're going to use for airways. So we're going to have our towel, our slippery sand, our saline, and our tubing for our saline. We're also going to have cardboard splints and cervical collars. This is our advanced airway kit, so it's got LMAs and for ventilation as well. We're also going to use, this is our paramedic IV kit. We're going to have a child's and an adult's bag valve mask. It's going to have the filters and the mask and everything in here with our PEEP as well. On this side, we're going to move into our other side of our pocket. So we're going to have our everyday drugs such as Panadol, ibuprofen, aspirin, and methoxyflurane. This one is our OPAs, NPAs. So we're also going to have rubbish bags in here, and there will be some forceps. We're going to have our laryngoscopes in one of these pockets as well. As we move on, we're going to have oxygen tubing, nasal prongs, and a child's and an adult's nebulizer mask. And we're going to have our more advanced drugs such as salbutamol, ipratropium, and adrenaline in here, which we can use. Today I'm going to show you how to use the suction unit. So the first thing we need to do is test that the suction unit is in good working condition. So we need to turn it to max, check that the battery's lit up so it's nice and charged, kink the tubing and hold down the test button. It should light all the way up to the top, but this suction unit is broken, so it won't. We also need to test the catheter by holding our finger over the hole and holding it onto our hand to check that it sucks. We also need to check that the catheter and the tubing are in good working condition, which these ones seem to be. Indications to use the suction unit are if your patient has a low GCS and has a foreign body or fluid stuck in their airway that they can't get out themselves. So to use it, we need to put our patient in the recovery position to expel most of the fluid. We need to put the catheter in only as far as we can see, holding our finger over here, and for a maximum of 10 seconds, and then as you come out in a circular motion. So the implications of the suction unit are that it can cause laryngospasms, hypoxia, soft tissue injuries, and induce vomiting. And we should never use a rigid catheter in a moving vehicle or with seizure patients. We should only use a soft catheter. Today I'm going to show you how to use an oxygen bottle. So normally they're either white or black cylinders and it will say oxygen on it. The second component is the regulator, and it has a Bodak seal in here, which I will check, and it seems to be in good condition. This is basically used to regulate the flow of oxygen. So we're just going to put it on and tighten it up. We align the prongs, and then I'm just going to check that it works. So I'm just going to turn it on and make sure that oxygen is flowing at every rate, which it is, so that's good. So our indications for oxygen are an SpO2 lower than 94%, smoke inhalation, carbon monoxide poisoning, respiratory distress, and shock, just to name a couple of them. Today I'm going to show you how to use nasal prongs. So when I turn it on, I want to have my bottle facing like on the ground so that it's much safer. So we're going to have the nasal prongs, and I'm going to connect this up first, and I'm going to make sure that I turn on my oxygen before I put it onto my patient. So I'm just going to put it really low, between 2 to 4 litres per minute and at 20 to 40% oxygen. It's pretty non-invasive, so these are used for our mild patients who don't need a whole lot of oxygen. So I've turned it on, I'm going to put it there, and we can also tighten it as we need to. When we've finished, we're just going to turn it off. Make sure our patient, we'll take it off our patient as well, but at this point I'll just take it off here. We're going to bleed the regulator so there's no more oxygen. So now there's none left. We can turn it to 0 and we can detach our regulator. Today I'm going to show you how to use the Philips defibrillator monitor. So the first thing I need to do is run an operational check. So I'm going to turn it one click onto monitor and wait for it to turn on. To get into operational check, we're going to go to menu, go down to other, press operational check and then run operational check, and we'll turn it up to 150 joules into manual mode. Whilst it's doing that, I'm going to start getting the test block ready. So I'm just going to plug the defibrillator leads into the test block, and it's going to ask me to perform a shock in a second, so I'll just wait for it to do that. So it's asked me to run a shock, so I'm just going to press charge and then shock.
Shock delivered.
So you acknowledge that I heard that shock was delivered, and it'll carry on with the rest of its check. So I'm just going to run you through the other elements of the defibrillator. So in this pocket we have our BP cuff, so we're going to have a child, adult and a large adult size. We also have our SpO2, which we just put on the end of the patient's finger like so. We also have our 3 lead, which I'm going to attach to our lovely patient here. So this black lead goes on the left arm. So just going to put it up by the shoulder here. The white lead goes on the right arm. So we're just going to attach that to the right shoulder up here. And then also this red lead goes on the left leg, so we're just going to put it just above the hip here, like so. We also have the ETCO2 tube, which just attaches to the patient via the ventilation tube if needed. In this pocket we have our 12 lead and our defibrillator leads with our pads as well, and then in the back pocket we have aspirin, spare paper, spare batteries and a razor. So I'm just going to wait for the defibrillator to run the rest of its check. So it's now finished its check, so I'm just going to print it to make sure that it passed. So we just press the print button down here, and to stop the printing I'll press this white button when I'm ready. So I'll just stop it there. So I can clearly see that everything's passed, there's no problem, so I can carry on. So I'm just going to exit the operational check, and I'm going to show you how to perform a shock. So to do that, I'm just going to put the test block away and attach the defibrillator pads to our patient. Tangled here, so I'm just going to put it up on our patient. These would normally be pads, but because we've got a mannequin, we're just plugging them in. So to run a shock, we're just going to press charge. We're making sure we're in manual mode at 150 joules. So we're just going to press charge, wait for it to get to 150, and then press shock. And that's done. We can also disarm a shock by pressing charge, waiting for it to get to 150, and then pressing disarm. And I'll just stop the printing there as well. So that's how we do that. We can also change the volume of the heart rate. So we go into menu, volume, we're going to go down to QRS, and we're going to press loud so we can see any change or hear any changes in our patient's condition. We can also change the ECG size by going to menu, displayed waves, wave 1, pads, and we'll keep it on ×1. And we can also change the view of the waves up here, but our patient's dead, so it's not going to change. We can also put the defib into AED mode. This is an automatic defibrillator, it'll tell us what to do. The last thing we need to do is check the battery and the paper for their defib. So to do this, I'm just going to move this over here. So we're just going to lift up this back pocket, and you can see that it has 2 batteries, battery A and battery B. So you can press the buttons on the top of the batteries to see how charged they are. But if you want to replace them, you just squeeze in the middle. They'll come right out, and you can put them back in. For the paper's kept in here. we're just going to pull it up. It's going to pop out like that, and we can pull the reel out. So we pull up this little tab, take out the paper. This paper doesn't need replacing, so I'm going to put it straight back in, and we're just going to put it straight back in like that, making sure that the paper is facing towards the back of the defibrillator. The reed has to be facing towards the back, and that's how to use the Philips defibrillator. We have been dispatched to a 65-year-old male who is complaining of chest pain and has since collapsed. The first thing we're going to do upon entering the scene is make sure that we check for dangers and also that we have an exit route planned, which we've done. Both Ali and I are wearing our glasses and our gloves, so we have the correct PPE, so we're able to enter the scene. Right, let's go. Hi sir, how are you? My name's Sarah and this is Ali, and we're here to help you today. Are you able to hear me at all, sir? So I'm not getting a verbal response, so I'm going to check for a pain stimulus. I'm also not getting a pain response, so I'm going to check his airway and make sure that there's no obstructions by doing the jaw thrust. And I can't see any obstructions, so I'm going to look, listen and feel for breathing for 10 seconds. I'm not getting any breathing. Ali, could you please start CPR? AUT1 to comms, could you please, we're requesting an R50 for a patient in cardiac arrest. So the first thing I'm going to do is make sure to set up the defibrillator. So I'm going to work around Ali to do this to minimise time off the chest.
Analyzing heart rhythm.
Right, Ali, could you stop CPR?
Do not touch the patient.
Nobody touch the patient.
Shock advised.
Right, stay clear, we're going to shock.
Stay clear of patient. Deliver
Everyone
shock.
clear, shocking.
Now, press the shock
Shock
deliver.
delivered, continue CPR.
Pause.
So we're going to put a towel under his head to put him in a sniffer's position and keep his airway elevated. The next thing we're going to do is start setting up our bag mask. So we're going to use our bag mask at 15 litres per minute of oxygen at 100% oxygen. So we need to watch for gastric inflation, barotrauma and hyperventilation when using the bag mask. So I'm going to turn this on to 15 litres. And we're going to make sure the reservoir bag fills up. The next thing we're going to do is set up our OPA. So our OPA, we're going to not use it if we have trismus or if the patient has a gag reflex. So we're going to measure from the corner of the mouth to the edge of the mandible. And this one seems to be a good fit. So when we insert it, we're going to make sure to put it in upside down. So the hook's facing towards the roof of the mouth, and then we're going to rotate it 180 degrees to push the tongue back, and it should slide right in. And then Ali, if you could start counting down from counting up from 25 until you get to 30. 25, 26, 27, 28, 29, 30. So we want to do gentle breaths, and we're looking for equal rise of the chest. And now I'm going to start putting in an OPA. So we're going to measure from the nostril to the edge of the mandible again. And this one also seems to be a good fit. So we're not going to use this if we have facial trauma or any traumatic brain injury. So I'm just going to make sure to put lots of lube on it, put it in perpendicular, and then push it down. If you encounter any resistance, just rotate it. The risk of the OPA and the NPA are soft tissue injury, so we just need to be aware of that. So Ali, if you start counting down, or counting up from 25 to 30 again when you're ready. 25, 26, 27, 28, 29, 30. 2 breaths.
Stop CPR.
Right, we're going to swap at this point because I can see my partner's getting tired.
Stay clear of patient. Analyzing heart rhythm. No shock advised.
Right.
Pause.
I'm going to continue
If needed,
CPR.
start CPR.
And we're going to do CPR at 1/3 of the chest, of the depth of the chest, and we're going to do 100 to 110 beats per minute. Ali's going to continue with the breathing, and she's going to tell me when to start counting, when she's going to count down for me so she can deliver the breaths.
25, 26, 27, 28, 29, 30.
So I can see she's doing a really good job, and she was also doing a really good job with CPR, so I didn't need to correct her on her technique. At this point, we're going to start asking for a patient history. So we're going to ask if CPR was carried out before we got here, medications, allergies, patient's history. And we're also going to just make sure that this isn't an event that's happened before, or if the patient has any conditions that would cause this, and basically wait for our backup to turn up, or until the patient's status changes even more. We'll just continue doing what we're doing.
25, 26, 27, 28, 29, 30.
So you can just see that when I'm doing my CPR, I'm coming off the chest to allow the breaths to take place, so I can make sure that the chest is completely filling up. If I have my hands on it, it's going to compress the chest.
25, 26, 27, 28, 29, 30.
Stop CPR.
I'm going to stop CPR. Everyone clear of the patient.
Analyzing heart rhythm. Stay clear of patient.
So we're probably going to swap again at this point.
Analyzing heart rhythm. No shock advised.
Right, continue CPR.
If needed, start CPR.
And I'll continue the breaths. And I'll count for Ellie at this point too. And you can see I'm doing the CE grip for our bag mask. This just makes us get a really good seal, so the oxygen's going straight into the patient.
You're counting or am I?
25, 26, 27, 28, 29, 30.